everyone, Nikita's here. So my today's topic will be the prolapse of uterus. So what is uterine prolapse? It is a displacement of the uterus from its normal position into the vaginal canal is known as prolapse of uterus or uterine prolapse. So what are the causative factors of this uterine prolapse? These type of serious cases of uterine prolapse occurs due to in case of genetic defect. Okay, so mother or sister, your mother or sister has suffered from the same problem. In that condition it may be occur. Then second cause like menopausal women. Okay, third like heavy weight lifting, strenuous activities. Okay, if you are pregnant and you are lifting the heavy weight and that causes your pressure on your uterus, in that condition the prolapse of uterus causes. Okay, so these are the causes which is responsible for the prolapse of uterus. So we will see what are the degrees of prolapse of uterus. For the treatment you should know what extent it has prolapsed. Okay, is it completely or is it incomplete? So we should know the degrees of prolapse of uterus. So there are 4 degrees of uterine prolapse. So first degree, like in that condition uterus had descended from its normal position. Okay, but external os still lies at its position. Next, second degree prolapse means in that condition uterus is a prolapse. Okay, from its normal position it is descend, but external os is protrude outside the vaginal wall. Then in third degree prolapse, cervix, uterine body and fundus, these all parts of uterus has protrude, but external os still lies at position. Okay, and in fourth degree of uterine prolapse, all uterus has descend from its position, complete prolapse happen. In that condition we will call it as a procedentia or complete uterine prolapse. Okay, in second degree prolapse we have seen cervix still lies at its position. Okay, external os. Okay, so these are the degrees of uterine prolapse. Based on this we will do the treatment. So what are the symptoms of this uterine prolapse? The symptoms of the uterine prolapse will be the vaginal signs. There will be a sensation as something passing down. Okay, ball like feeling when we sit on this. Okay, everywhere there will ball like sensation. Then vaginal discharge will be there, pruritus vulva, leukorrhea like sensation. Then we will see constipation. Okay, congestive movement in your abdomen. Okay, the strenuous activities will be increased. Then in urinary symptoms there will be increased frequency of micturition, painful micturition, dyspareunia, loss of sexual activities. Then we will see the symptoms like lower back pain. Okay, there will be a means pelvic support. This uterine prolapse main cause will be there is a loss of pelvic support, pelvic muscle, pelvic floor muscle known as levator and eye muscles, ligaments. They had loosened or they had lost the support. That's why the uteri is prolapsed, because it is bound by the broad ligament, McIntosh ligament and all, and this support has gone. That's why the uterine prolapse is happening. So these type of symptoms will be seen, like bearing down sensation will be there, increased frequency of micturition, strenuous heavy weight lifting also causes this pressure on uterine region. So then retention of urinary tract infection. So these are the symptoms that could causes it. There will be a pain. Okay, pain will be the first symptom, like vaginal pain, bearing down sensation. This is the most important symptom. Okay, so these are the symptoms of uterine prolapse. So in allopathy there is a treatment like pessary treatment. Then differential diagnosis by cervical polyps or all that, fibroids of uterus, complete eversion. Okay, eversion of cervix. This will be the differential diagnosis. So what should be your diagnosis? Investigation by the inspection, palpation will be the main investigation in that case. Then we will see ultrasonography, MRI, CT scan. This will be the investigation procedure for the confirming there is a uterine prolapse. Okay, so we will see next we will see what is the homeopathic management. In many cases homeopathy had very good effect. Okay, homeopathy had very good management over the uterine prolapse. So come to the point, homeopathic management. First medicine like collinsonia. So in that patient, in that ladies, okay, so cholinsonia patient, during the pregnancy there is a obstinate constipation is present. Due to this obstinate constipation, there is a feeling of obstruction. Okay, so this to get rid of this feeling of obstruction has to strain much. Okay, during labor, during parturition, it also have to strain. That leads to prolapse of uterus. Okay, so next medicine like podophyllum. Podophyllum has a very good management in cases of second degree prolapse. Okay, cervix still lies at the position of the external os. In that condition, podophyllum will be the very good homeopathic remedy. There is a long-standing diarrhea will be present. Okay, in that condition, this long-standing diarrhea often alternates with constipation, often alternates with diarrhea. There will be a morning diarrhea. So this diarrhea will be like a putrid, painless, polychromatic, prolapsing. Okay, then it may be painless. So these are the 5 P's of these diarrheas. Okay, so that leads to uterine prolapse. Then third medicine like sepia. In the sepia, there will be sensation, bearing down sensation as something passing down from its abdomen, or uterus is lying down, right? So there will be sensation like something bearing down. Okay, so in that condition, female or patient who is suffering from this, that she will tell she has to cross her limbs or protruding before protruding. Okay, so she has to cross her limbs to get ameliorated. And in the cholinsonia patient and podophyllum patient, these both ladies have amelioration by lying down. Okay, on lying down she will be ameliorate these symptoms. Then on next medicine like lilium tick. In that patient there is a means uterine prolapse is due to there is a heavy weight lifting or lack of pelvic supports. And lilium tick patient always she tells that the patient will tell you that she always feel that she needs something to support her uterus. Okay, so in that condition we will give lilium tick, and it this condition will follow pregnancy, followed by pregnancy and parturition. Okay, so next medicine like agaricus. In that patient, the uterine prolapse is due to the reason like menopause, cessation of menses. Menopausal means we have seen that there is a prolapse of uterus. So cessation of menses, heavy weight lifting and increased abdominal pressure in the uterine region, that will lead to the, so agaricus will be the good homeopathic medicine in case of uterine prolapse. Okay, next medicine like calcarea ka. This patient will be fat, flare and flabby. So these operating mechanism is due to the increased abdominal pressure and heavy weight lifting. Okay, so this will be the causes for uterine prolapse. Then next medicine will be the allosocotrina. In that patient, allosocotrina patient, there will be hemorrhoids are present. Patient will be the exhausted, prostrated, exhausted patient will be. So this patient have hemorrhoids and often suffer from rectocele. There are 2 types of uterine prolapse is there, that is uterovaginal prolapse and complete congenital prolapse. Okay, so in uterovaginal prolapse there will be a cystocele present, means related to urinary bladder. Okay, symptoms related to urinary bladder. So in uterovaginal, cystocele will be the common condition. And in allosocotrina patient there will be rectocele, means there will be associated with rectum. Hemorrhoids, piles patient, okay, bleeding piles will be there, so that leads to uterine prolapse. And lilium tick patient, Lilium tigrinum, that patient will associated with symptoms of cystocele as well as rectocele. Cystocele will be the common position for them. So this is the homeopathic management that will work in your uterine prolapse condition. So you should take a homeopathic management because homeopathy has individual remedy for the individual patient that will lead to your complete cure. So if you like this video, please like, share and subscribe my channel. Thank you.